You're listening to Medscape's In Discussion series on multiple sclerosis, a podcast where thought leaders and clinical experts share their diverse insights and practical ideas for optimizing patient care. This series is hosted by Dr. Ann Cross. Dr. Cross is a professor of neurology and holds the Manny and Rosalind Rosenthal Dr. John Trotter MS Chair in Neuroimmunology at Washington University and Barnes-Jewish Hospital in St. Louis, Missouri. Relevant disclosures can be found with the episode show notes on Medscape.com or the Medscape app. The topics and discussions are planned, produced, and reviewed independently of advertisers. This podcast is intended only for you as healthcare professionals.
Hello, I am Dr. Ann Cross, and welcome to Medscape's In Discussion series on multiple sclerosis. Today, we'll be discussing exercise and multiple sclerosis. And first, let me introduce my distinguished guest, Dr. Robert Motl. Dr. Motl is a professor in the Department of Kinesiology and Nutrition at the University of Illinois in Chicago, where he also directs the Exercise Neuroscience Research Laboratory. His research focuses on physical activity and its measurement, predictors, consequences, and interventions in persons with neurological diseases, particularly multiple sclerosis. Welcome, Rob, and welcome all to In Discussion. Before we dive into the more technical parts of this discussion, could you just tell us a little bit about how you got into the world of MS and exercise? What led you to this place?
My background is really in the field of exercise science. I earned a PhD in exercise science and then went on to do a postdoctoral fellowship in exercise science. And my focus during that time was really on exercise neuroscience for understanding the brain exercise synergy and how we could use exercise behavior as a way to manage different neurotransmitter systems that were dysregulated in conditions like depression and anxiety. As part of my dissertation and postdoctoral fellowship, I was doing a lot of work on exercise with different combinations of substances and looking at its effects on spinal reflexes. And I was doing that because we were trying to identify this kind of muscle relaxation type effect that many people report after they engage in a bout of exercise. And all of my research showed that exercise in these individual bouts of exercise could reduce the excitability of this synaptic reflex that was really being modified in the spinal cord, but it had nothing to do with feeling less tense or less anxious or things like that. So one day, by serendipity, I picked up a journal in the library, and there was a paper on baclofen for treating spasticity in people with multiple sclerosis. And everything that they were doing in this study was identical to my dissertation research, with the exception is they were studying baclofen and I was studying exercise. I wrote a small grant to the National MS Society on exercise for spasticity in people with multiple sclerosis. They funded it, and through that serendipity, a meaningful career and meaningful research agenda started and has really taken off.
Wow, that's great. And it's great for the National MS Society too, because they start so many people on great careers like yours with even small grants, like you mentioned. Kudos to them as well for funding you. And you've remained in the field all these years. You've worked a lot with exercise training in people with MS of different types. What is your general recommendation if you were talking to a group of MS patients about exercise? What would you say?
A lot of times people ask me the question, is exercise training and how you do exercise training substantially different in people with MS compared to those who don't have MS? And one of the first things I say is overall, there really isn't much difference in how you think about exercise training. We think about exercise training as a behavioral approach to try to promote adaptations in human beings and ultimately promote a lot of secondary benefits. I think that we approach MS in the exact same way. We want people with MS to engage in exercise. And we want them to engage in exercise because we know that there are so many different benefits of engaging in exercise behavior. Now, where I think the two start to dissociate, that is exercise for people with MS versus exercise in the general population, is the outcomes that we focus on and the reasons that we focus on those outcomes. So lots of times people with MS will detrain. Their aerobic capacity will decrease, their muscle strength will decrease. That will result in many other problems, such as the inability to walk or the compromised capacity to walk, and ultimately resulting in symptoms such as fatigue and depression, reduced participation in meaningful life activities and quality of life. When we talk to people with MS, we really want to focus on meaningful benefits of exercise training for them. That is, exercise training can restore their aerobic capacity, it can restore their muscle strength, it can help them be able to walk more efficiently and quicker. It can help them reduce their fatigue, reduce their depression, maybe even sleep better. It can help them be able to maintain their employment and their activities of daily living. Doing those things such as going to the park and playing with your kids. All of those things become substantially more important in MS. And so we really try to focus on this idea of the exercise training approach is the same, but the reasons why you're doing it are so much more important for maintaining your overall life quality and participation.
And do you have any special recommendations for people who might be confined to wheelchairs?
The majority of the research to date on exercise training in people with multiple sclerosis is really focused on those who are independently ambulatory, meaning that they walk without a device, or they might walk with a cane, maybe early two-point assistance like a rollator. But we don't know a lot about exercise training in the more advanced stages of the disease where someone might use a wheelchair or a scooter. What we do know is that these individuals still can engage in exercise. It just might look a little bit different. For example, if you want to get aerobic exercise, you're probably going to use an arm bicycle ergometer. So instead of pedaling with your legs, you're going to pedal with your arms. If you have access to a device that you can move your arms and legs at the same time, such as a arm leg pedal ergometer or stepper, those are great because you can oftentimes use your arms to compensate for maybe more weakness in the legs. Swimming is a great form of aerobic exercise for individuals who might have more advanced disease. But we don't want to just focus on aerobic exercise for wheelchair users. We also want to think about resistance and strength training. We oftentimes recommend that people could get resistance bands. You can find these very easily. You can do resistance without having to go to a gym, and you can do a full body workout, upper body. You can do some core work with it. You can even do lower extremity strength training, and it can really have some significant benefits. Also thinking about things like the bands that are elastic that you can put around your ankles or your wrists. Those also can serve as nice forms of resistance training. I know this is going to sound silly, but even going to the kitchen cabinet and finding things that you can hold in your hand, like cans of vegetables or a jar of pasta sauce, you can use those for doing upper body resistance training as well. While we don't have the evidence-based programs right now, we're working on them, but we don't have them yet. I think that there's a lot that people with more advanced disease can do to engage in exercise.
What would you recommend to the person listening who has MS, maybe is on a scooter or in a wheelchair to start? Like, should they see a physical therapist or go to a online site for advice?
That's a great question. If someone's in a wheelchair, they might want to talk to their neurologist about whether or not it's appropriate for them to see a physical therapist or an occupational therapist before they start a program, just to do an evaluation. But that also might be cost prohibitive for a lot of individuals. I will say that the National MS Society has created some really lovely resources for people with MS on exercise training. And a few years back, we even created some guidelines for physical activity and exercise training in individuals with advanced multiple sclerosis, wherein they're navigating the world in a wheelchair or a scooter. We just have to recognize that they're not evidence based. They're really much based on the opinions of experts. But I think they're a good shot and they're a good place to start. And I think that people are evaluating and studying them now. So we'll have that evidence base behind them soon.
So, changing directions a tiny bit, you have mentioned a couple of times now the potential benefit of exercise on depression and mood disorders. And I believe you are doing a study now, maybe it's finished, on the effects of exercise on depression. Can you tell us more about that?
We know that depression is a very common symptom in people living with multiple sclerosis. We also know that there aren't a lot of good treatments for depression in people with multiple sclerosis. When we look at the literature on exercise training and depression and MS, we can see that there is a very strong improvement in depression and symptoms of depression in people with MS who engage in exercise training. And so that's great. The one thing that's missing from the literature, however, is the effects of exercise on depression in people with MS who have major depressive disorder. So a clinical diagnosis of depression and MS. We were fortunate to be funded by the Department of Defense and the CDMRP to do the first trial on exercise training and major depressive disorder and multiple sclerosis. We're not done yet, so listeners will have to wait a little while before the study's done and the results are published. But the uptake of this intervention has been very successful. We've had lots of interest in this program, and we're really thrilled with the rate of enrollment and people staying with the program itself. I can give two pieces of advice on what to do with exercise for depression and MS. One of the meta-analyses that have been published in this area has demonstrated that meeting physical activity guidelines for the general population yields 2 times greater improvements in depression in people with multiple sclerosis than not meeting the physical activity guidelines. And what that means is doing between 90 and 150 minutes of physical activity per week will have twice as much of an effect as doing less than that. Now, that sounds like a lot, but I just wanted to point that out because that is one of the big findings. The other finding from the literature is based on a meta-analysis that looked at the dose of exercise and how the dose of exercise was related to depression in people with MS. And this meta-analysis reported that the more days per week that an individual engaged in exercise training, the greater the reduction in depressive symptomology. So as you went from 1 day to 2 days to 3 days, the effect of exercise on reducing depression essentially doubled in magnitude.
Wow. That is fascinating and very practically useful information. What about the effects of exercise on fatigue? A lot of my patients, well, many MS patients have fatigue, as you know, and many will say they don't want to do exercise because they're so tired.
I hear the patients. I hear this pretty readily when we encourage them to engage in exercise. If I engage in exercise, that's going to utilize my energy, and then I'm going to have less resources, fewer resources for the rest of the day. I don't discount that concern. I think that anytime someone starts an exercise program, whether they have MS or not, they will become a little bit more fatigued. It is a little bit exhausting. It is a little bit tiring. But the key for people with MS is start small, start slow. Don't dive into doing 3 days per week for 30 minutes of aerobic exercise. That is going to wear you out. Start with 5 minutes. Do it 2 days per week and see how your body feels. You're probably still going to be a little bit fatigued, but what happens is as you repeat that bout, your body gets accustomed to it. It develops resources, it develops resilience. And then instead of becoming fatigued after that 5-minute bout, you'll feel a little bit more energized, a little bit less fatigued. And then after a while, you move up to 10 minutes and then 15 minutes, but slowly. And what we find is that individuals who follow a simple prescription of starting slow, 5 minutes, 2 days per week for a month, ramping up to 10 minutes, 2 days a week for the next month, and so on and so forth. Once they get up to about 30 minutes, 2 days per week, they'll experience a reduction in feelings of chronic fatigue and malaise. I want to point out that people can do either aerobic or resistance exercise, so cardiovascular exercise or muscle strengthening exercise, and both will yield improvements in fatigue. And if you do both, you'll get even greater improvements in fatigue over time.
Wow, I hope I can prescribe this to patients and they will do it. It sounds wonderful and good all around for health. Getting a little bit more into the science of exercise, what is your take on whether exercise is truly neuroprotective or not? I ran across a couple of papers showing increased neurotrophic factors in people who are exercising in an exercise program. Is that true? And what does that mean?
I think where I like to start when I think about this notion of exercise and neuroprotection is starting with neuroimaging data. And I think if we look at neuroimaging data, we're generating a larger and larger body of evidence that shows that exercise can prevent the atrophy of specific areas of the brain, such as the thalamus or the basal ganglia, which are major areas of the brain associated with movement. We're also starting to see evidence that engaging in exercise training can promote new connections with the brain. So, looking at functional connectivity, we see better connections between, for example, the thalamus and the frontal cortex. As we're seeing these changes in brain structure and function and organization, the question becomes, how does that occur? One of the most common hypotheses is what you brought up, Anne, which is this effect of exercise on neurotrophic factors or these nerve growth factors or nutrient factors like brain-derived neurotrophic factor. And in fact, there are really good data from meta-analyses showing that exercise training, particularly aerobic exercise training, results in the upregulation of BDNF in people with multiple sclerosis. Now, the only caveat that we have to bring up is that we're wanting to make an inference that the BDNF that we collect in the peripheral blood sample actually reflects something occurring in the central nervous system. And so there's been a lot of debate on whether or not, in fact, peripheral BDNF reflects central nervous system BDNF and brain BDNF. But the evidence is really pretty clear. Exercise upregulates neurotrophic factors. Now, the other thing that we've been hypothesizing is this notion of exercise as a multi-system, multi-brain region activating behavior. And this is actually the complement of network failure, which is all the rave these days. The idea of network failure is that the brain's networks and communication pathways are failing as the disease is worsening. And we have proposed a model some years ago that exercise training stimulus is a behavior that activates nearly every brain region in the central nervous system because the brain has to regulate the body during human movement. And because you're activating all these different pathways, it's forcing these pathways to have to adapt, to have to strengthen themselves and increase their neural connection. And you get pruning in some areas that you don't need, and you get strengthening of connections in other areas. So we actually think that this might look more like a stimulus that is activating multiple connections throughout the brain and ultimately helping the brain reorganize to have greater connectivity and ultimately explain the many adaptations that we see with exercise training.
Is there any evidence that exercise induces remyelination?
So there are some data out of Canada using animal models and studying the effects of exercise in different animal models of multiple sclerosis, most notably the lysolecithin animal model of MS. And that research was able to show remyelination in this animal model of multiple sclerosis following exercise training. Those data are really phenomenal. The challenge has been studying remyelination in human beings, and no one has really done that in a very compelling and systematic way. I know some people are thinking about this and they're trying to figure it out, but it just hasn't made it to prime time yet.
I wanted to ask you, is there a specific type of exercise that one might do, or is it better to combine resistance and aerobic for elevating things like neurotrophic factors, BDNF?
We are actually recommending that people engage in walking exercise, and in particular, walking outside as part of everyday life. And the reason for that is when you're walking outside, you're having to not just control your body, but you're having to process lots of information about the environment around you. And we actually think that while walking and processing all that information about the world around you while you're walking actually helps to stimulate the brain more and would stimulate things like BDNF, but also the connections that you need to strengthen.
Fantastic. I can't let you go without asking you about the COG-X study, which I believe you were involved in, and was the idea was to see if exercise therapy would improve cognition in persons with MS. Did I get that right? And what can you say about that study?
Yeah, boy, Ann, you picked a hot topic right now, COGX. So I was a co-investigator on the COGX study. And what COGX tried to do is look at exercise versus cognitive rehabilitation versus exercise plus cognitive rehabilitation on cognitive functioning in people with progressive MS who had cognitive impairment, particularly slowed cognitive processing speed. We utilized the state of the art cognitive rehabilitation intervention called REACOM. We also used an aerobic exercise training program that involved one bout per week of continuous exercise and then one bout per week of high intensity interval training. And then lastly, we had sham conditions. So conditions that tried to mimic cognitive rehab and tried to mimic exercise as our really sham control conditions. So at the end of the day, what we found is that exercise alone, cognitive rehabilitation alone, exercise plus cognitive rehabilitation, and the double sham all resulted in equivalent improvements in cognitive processing speed in these people with progressive multiple sclerosis. There was a lot of debate on whether or not this was a successful trial or a negative trial. And people who took the successful trial perspective came away with the notion that in people with progressive MS, anything that you do that involves a stimulus that activates the central nervous system, whether it's cognitive rehab, whether it's sham cognitive rehab, whether it's exercise or sham exercise, is good for improving cognitive function. And I do think that there's some legitimacy to that activation hypothesis. On the other hand, there are those of us who thought that there were some major design considerations that probably prevented us from making too strong of a conclusion. For example, that study did not have a true control condition where individuals did not receive any therapeutic intervention. And so we don't know if the improvements that we saw in cognition were just learning how to do the cognitive tests better with repeated exposure over time. So there are real practice effects with these cognitive assessments. The other issue was that we didn't have a true kind of non-active control condition. The physical activity sham was actually a very strong physical activity program, and it might have been too strong. It might actually be just as good as aerobic exercise. And then lastly, one of the problems from my perspective as someone from an exercise science background is we don't know about the proper dose of exercise training for improving cognitive function in people with progressive MS who have cognitive impairment. So I think there are some things that we want to think about in designing a future trial in this space. And we don't want to be too harsh, but we also don't want to be too forgiving, right? We want to kind of play that middle ground, be the centrist, so to speak.
Well, I have thoroughly enjoyed this talk. I just want to remind our audience that Dr. Rob Motl is probably the world's expert on exercise in MS patients. Certainly, he's up there. He's spent his entire career focused on what exercise can do to help people and particularly people with MS. And thank you from me and all those people out there who have MS or love people with MS for doing this work and spending your career doing this and achieving so much to help us in an area that's been hard to study. And you've done a great job of making studies scientific and interpretable. Dr. Motl pointed us out to the National MS Society's resources on exercise, which he helped develop, and there are guidelines online there to search for. So all of this is just fascinating and very helpful adjunct to our treatments. And hopefully our listeners out there will be able to take some benefit from this.
Thank you, Anne. And really, the pleasure has been all mine. I just want to point out one thing, that MS has actually given me more than I've ever given it, in that it's given me meaning in my research and my career. So I'm really indebted to MS more than MS should ever be indebted to me.
Well, I'm not sure I agree with that. I think the MS community would not agree with that, but thank you for devoting your career to this topic.
Thanks for listening to Medscape's In Discussion Multiple Sclerosis podcast series with our host, Dr. Ann Cross. Be sure to look for more In Discussion episodes wherever you get your podcasts. Check out Medscape.com or the Medscape app for show notes, links, and more information on multiple sclerosis.